Welcome to Module 2 of our education program. This is by myself, Brittany Hartman, and Samantha Dittmer. Last session, we went over that educational programs are important in the areas of feeding education as well as mental health. Maternal mental health and feeding education is needed. We want to increase the knowledge in these areas while also decreasing the stigma. We also know that OT has involvement in mental health, and we gave an intro to OT feeding and EI. We learned that OT overall specializes in child development and mental health. I'm going to start off the presentation today with infant and toddler development as it relates to feeding. By the end of this presentation, I hope that you'll be able to understand the variations in development. I hope you'll be able to recognize and explain 3 typical feeding development milestones for infants, as well as recognize and explain 3 typical feeding development milestones for toddlers. So I wanted to start off by discussing feeding in general. A baby's growth is powered by good nutrition and strong feeding abilities. Feeding is more than just eating and drinking. It helps your baby develop the muscles used to chew, swallow, and digest their food. A baby will go through many stages of feeding development, and all of them are important to their growth. So what is feeding? Feeding looks different at every age for babies and young children, but it is the intake of nutrition that helps babies grow, develop, and thrive. Most babies begin life by breast or bottle feeding and slowly build up to solid foods. There are various feeding milestones a baby will meet throughout the first 36 months of their life. These stages help the baby slowly build up to solid foods. So while they begin by consuming breast milk or formula, a baby typically graduates to purees and then small solids shortly after. There are variations in development, as you will see throughout my presentation. Some milestones I will discuss have a wide range of time the child is expected to reach them. The timing of milestones varies greatly throughout a child's development. Some children may not reach a milestone in the expected time during their development, and this results in a developmental delay, which ultimately means the child is just slow to develop that milestone or skill. Just because a child is slow to develop a skill does not mean they will never develop that skill. Skill acquisition is a type of learning in which repetition results in long-lasting changes in an individual's capability to perform a specific task. So with occupational therapy and working on a skill with your child, they can develop that skill. It may just be later than their peers. I really wanted to stress how development varies based on the child, because throughout the rest of my presentation today, I'm going to review the natural development of infant and toddler feeding. And as I have age ranges beside a specific skill, if your child is that age and has not achieved that skill, it is okay. It's just important to remember skill acquisition and how important it is to practice those skills with your child. To start off, I'm going to review the natural development of infant feeding. I know it can be daunting to have a list of skills in front of you, again, that your child may or may not have reached yet. But my overall goal is to just inform you and teach you about the natural development of infant feeding before I go into talking about difficulties with feeding and how to address them in later modules. I just felt like this was a good way to start. So, by 1 month, your child may open and close their mouth in response to food stimulus. From 1 to 5 months, your child may synchronize sucking, swallowing, and breathing. By 2 to 4 months, your child may bring their hand to their mouth, and this is a beginning skill which later will lead to self-feeding. From 3 to 6 months, your child will be able to swallow strained or puree foods. From 4 to 8.5 months, your child may use their tongue to move food around in their mouth. From 4.5 to 5.5 months, your child may place both hands on their bottle. Again, this is a starting skill, which later they will use to hold the bottle in both hands and grip the bottle to drink on their own, not have you holding the bottle for them. From 5 to 8 months, your child may mouth and munch solid foods, and this is an appropriate age to begin solid foods. And from 5.5 to 9 months, your child may hold their own bottle. I have several videos throughout the presentation that are about a minute each. They show some of the feeding milestones in action, which I believe is great for the visual learner. So this video depicts some feeding milestones from 4 to 6 months. The natural development of infant feeding continued. So from 7 to 12 months, your child may drool less, except when teething. From 8 to 13.5 months, they may chew food with coordinated movements. From 9 to 12 months, they may finger feed themselves, and they also may hold a spoon. This does not mean they're holding a spoon to eat, it just means they're holding a spoon without dropping it out of their hand immediately. From 8 to 10 months, they may bite food voluntarily that you have in your hand and you put by their mouth. From 6 to 12 months, they drink from a cup held for them. So if you're holding a cup up to their mouth, they may start drinking from it. And from 6.5 to 8.5 months, they may feed themselves something such as a cracker. This video shows some feeding milestones from 7 to 9 months. Now, this is the natural development of toddler feeding. So from 12 to 18 months, your child may refuse foods and their appetite decreases. From 12 to 15 months, they may bring a spoon to their mouth and turn over the spoon. From 12 to 18 months, they may hold and drink from a cup with some spilling. From 12 to 15.5 months, they may hold a cup with a handle. From 15 to 23 months, they may scoop foods, feed themselves with a spoon with some spilling. And if they're not doing this yet, by 24 months, it's appropriate to start encouraging that spoon and fork use so they can self-feed. From 18 to 19 months, they may give an empty dish to an adult. From 18 to 23 months, they may distinguish between edible and inedible objects. From 18 to 24 months, they will start chewing foods completely. So have that rotary movement down in their mouth to then chew the foods completely and swallow. From 18 to 24 months, they may give up the bottle. And from 19 to 23 months, they may begin playing with their food, which isn't always a bad thing because it allows them to explore that food, especially if it's new, before putting it in their mouth. In this video, you'll see feeding milestones from 10 to 12 months. And the natural development of toddler feeding continued. So from 20 to 30 months, your child may hold a small cup in one hand. From 23 to 25 months, they may have definite food preferences. From 23 to 25 months, they may also begin unwrapping foods on their own. From 24 to 30 months, they may hold a spoon in their fingers with the palm up rather than just hold the spoon in their palm. From 29.5 to 31.5 months, they may begin to reject many foods. This could be foods they were eating before with no problem, and their taste buds change, they don't like it anymore. This is also when you may see them become picky eaters. And it's just important to keep introducing those foods So hopefully they will stop rejecting them eventually. From 30 to 36 months, they may pour liquid from a small container. So this is also when you can encourage them to be more independent. So giving them a small or like a cup of water to then pour into their own cup. So it's giving them that independence. They may also begin to use a fork and napkin at this age. And then from 31 to 36 months, and you could also see this beyond 36 months, which is why I have 36 months plus. They may serve themselves at the table with little spilling. So again, to promote that independence, you can give them a plate and have them put food on it themselves and bring it to the table or bring it to their tray on their high chair or booster seat. They also may show interest in setting the table, so you could begin to have them help you set the table at dinner. This video shows a couple feeding milestones from 13 to 18 months. I have a couple knowledge check questions built into the PowerPoints. So this one is, at what age should you encourage your child to use a fork and spoon to self-feed? Is it A, 18 months, B, 24 months, C, 30 months, or D, 36 months? The answer is B, 24 months. Earlier in the PowerPoint, I said that from 15 to 23 months, your child may begin to scoop food, feed themselves with a spoon with some spilling, but by 24 months, it is appropriate to begin to encourage that spoon and fork use to have your child self-feed. And my second knowledge check question is, what is the appropriate age to introduce solid foods to your child? Is it A, 4 months, B, 6 months, C, 9 months, or D, 12 months? The answer is B, 6 months. Again, earlier in the presentation, I had said from 5 to 8 months, your child may be able to mouth and munch solid foods, and this is also the appropriate age to introduce solid foods. This is a feeding milestones checklist I found that I thought would be very beneficial. So it's by pathways.org, which is what the videos were also by. In the yellow boxes, they have the age ranges, and then at the top you see they have feeding milestones for those ages. They have appropriate foods that you can begin to introduce at that age, and then they have feeding tips for that age as well. So I thought this was a really great resource. I know it's a little blurry on the PowerPoint, but I can definitely send you those resources, and I will. And I also have a resource, a handout that goes along with this PowerPoint that I will send as well.
So for this segment on mental health, we're going to be talking about postpartum depression. To start off, I would like to just go over some general definitions that will be brought up throughout the course of this module. So we're going to start off with antenatal depression, and that is described as depressive symptoms throughout the course of pregnancy. We have baby blues, which is described as depressive symptoms that begin within the first 2 to 3 days after delivery, and these symptoms should lessen and disappear within 14 days after delivery or 2 weeks. These symptoms may only last for a few days for some people. It could last a few minutes or even a few hours, but it should definitely be subsided for the most part by 2 weeks. So once it passes those 2 weeks, we would describe it as postpartum depression, and postpartum depression is described as depressive symptoms that last beyond the 14 days after childbirth or up to a year. And postpartum depression can range in severity. Some people describe their postpartum depression as very severe, while others may only have mild symptoms. And this can just vary depending on the day and the circumstances throughout the course of this diagnosis. And then we have stigma, which I'm sure people have heard about, the stigma surrounding mental health. And that's described as a negative or unfair beliefs that a society or group of people have about something. So these are just some general definitions that I may bring up, and I just wanted you to have a background knowledge on what those definitions meant. So how common is postpartum depression? So 70 to 90% of all women experience negative feelings or mood swings after childbirth. This can be due to the fluctuation of a bunch of different hormones that a woman will experience throughout the course of pregnancy and after childbirth. 15% of women will experience postpartum depression. 20% of women with postpartum depression will still experience those symptoms beyond the first year after childbirth. 13% of women with postpartum depression still experience depression beyond 2 years after childbirth. And 40% of women will relapse during other pregnancies or on another occasion throughout their lifetime. So let's go over some symptoms somebody may experience when they have postpartum depression. It is important to keep in mind that some of these signs and symptoms are the same symptoms you will experience when you have what we call the baby blues. But like I said, these symptoms will be longer and be more severe. And these are the symptoms that would last beyond those 14 days when it is considered baby blues. So these are the symptoms you may experience, but for it to be considered postpartum depression, you will have these continuing past 2 weeks after childbirth. So we have sleep disturbance or insomnia, and this is due to your body. This isn't necessarily due to the baby maybe waking you up throughout the night. We have irritability and mood swings, feeling easily overwhelmed, anxiety, fatigue, suicidal thoughts. We have appetite fluctuations, so maybe one day you feel like binging on food, and the next day you don't have any appetite at all. We have feelings of sadness and maybe withdrawing from people you're normally close to, such as friends and family. Here's a video I found that I think describes really well what postpartum depression may feel like for some people, and this is an interesting video because it's coming from the perspective of inside her head. And what she might be experiencing in this video is what we call intrusive thoughts, and I will go more into detail about intrusive thoughts in later modules, but here is a video that I think describes some of these symptoms very well. Okay, so causes and risk factors that could contribute to having postpartum depression. So there's no direct cause of postpartum depression, but it may be due to a rapid decline of hormones after childbirth, and these two hormones are estrogen and progesterone. And our hormones during pregnancy and after giving birth are changing at rapid rates, therefore increasing the intensity of mood swings, and it has altering effects on our body. Postpartum depression can also be caused by maybe emotional issues such as being sleep deprived and overwhelmed. A previous history of mood disorders or anxiety can be a risk factor for postpartum depression, and also having untreated depression throughout pregnancy. So therefore, if you are experiencing depression throughout your pregnancy and you have no treatment for it, those symptoms could just linger on and become more severe after giving birth. Other factors may include having low support from family and friends, increasing the feeling of being lonely, or maybe having nobody to relate to or talk to, violence in the home, being exposed to previous trauma or abuse, and this can be from your birth experience or maybe other experience before childbirth or even pregnancy, and genetic factors. So this is a good one to look at how maybe your family members have handled their postpartum experience. And this can be an indicator, maybe if your mother had severe postpartum depression. That's just something to keep in mind for yourself, and maybe start monitoring yourself throughout pregnancy for those symptoms. So it's important to remember that postpartum depression or depression in general can have more effects on you than just mental effects. So here are some effects that antenatal or pregnancy period depression may have on the body. So antenatal depression or depression throughout pregnancy can have more effects on our health than just the obvious symptoms. So we could have possibly GI or stomach distress, such as pain and digestive problems. We can get headaches, dizziness or vertigo, shortness of breath, and heart symptoms. So this could be maybe skipping beats, pounding, or fluttering of the heart. And antenatal depression has also been shown to increase your risk of giving birth to a baby that has low birth weight and or having a preterm birth or preterm labor. Like I said before, depression in general can have more effects on you than just mental effects. So here are some more health effects that depression could have on the body. So depression can overall lower your immune system, making you more susceptible to chronic illness. Chronic stress and depression can put strain on the heart, and this can lead to an increased risk of heart disease. And chronic inflammation could be caused by depression, leading to overall more illness and an increased chance of developing autoimmune diseases. Postpartum depression in fathers. So this is something I have found to be less known among people, that fathers or your spouse may also experience postpartum depression. And this can be called sometimes paternal postpartum depression. Fathers can experience a lot of the same symptoms as women, such as sleep deprivation, feeling sad or overwhelmed, increased fatigue, and increased anxiety. Some risk factors for paternal postpartum depression are past history of depression or mental health disorders, or things such as outside factors, maybe relationship struggles or financial hardship. What is preventing women from seeking help? In order for professionals to help mothers that have postpartum depression symptoms, women need to seek out services. However, studies show that most women are reluctant to seeking out care. Therefore, healthcare professionals are unable to provide them with support. Some women state that they are ashamed to admit their feelings to loved ones. Therefore, they suffer with them in silence. Other women are unaware that their symptoms are going beyond the typical range. Therefore, this is where education is important. Overall, it is shown that stigma is the main reason women avoid reaching out for help, and they may also be unsure of where to go. So what can we do? So for yourself, the caregiver, know the signs of depression and be aware of how it may present within yourself. Monitor yourself for the symptoms and be honest about the severity of symptoms you're experiencing. Remind yourself that just because postpartum depression may not be talked about often, it doesn't mean that's something a lot of people don't experience. We will talk about specific coping strategies and ideas of what to do in sessions to come. Create a plan. Know what you're going to do if you realize that your symptoms are becoming more severe. Create a list of things that make you feel better, ideas that could take your mind off of the symptoms you're experiencing, and create a plan of who you're going to talk to. So if you're part of the support system, know what symptoms to look for within your loved ones. Be aware of this if this person becomes withdrawn or starts acting out of character. Open up a conversation. Ask them how they're feeling and what you can do to help. Encourage them to talk about their feelings and the honesty of the symptoms they're experiencing, because they could be suffering in silence. Offer support. Offer to watch the baby so they can get some sleep. Maybe offer to cook a meal or drive them to a doctor's appointment. Offer to just be there for emotional support. Anything can be helpful in a time of need. So here's a little knowledge check for everybody. Baby blues are referred to as depressive symptoms experienced shortly after birth. When is the latest that these symptoms should disappear? The answer is 14 days after delivery. Baby blues should disappear at the latest in 2 weeks. Experiencing depressive symptoms beyond that time frame would meet the criteria for postpartum depression.